So if you see, I've just listed out some items here, skills and knowledge required in this domain. So if you are aware, business analyst is expected to understand the business process of the customer or the client for which a software solution or a product is being offered, and then to propose a solution for the client, to build a solution or to customize the existing solution. And product manager is someone who is responsible on a higher level, that is how to analyze that product with respect to the others in the market, how to understand the pain points of the customers in the market and build a product which is useful for uh, that particular industry and that particular business process. And product management is not limited to software. Product management can be anything. We can see a lot of simple products around us, which have been designed very meticulously and which have a great competitive edge over the other products in the market. It can be an electric appliance, it can be a vehicle, it can be anything. Product is anything. After analyzing the market requirements, that product is built. So this is the second part. So if you see here, for a career in this domain, it is expected to have proficiency in healthcare specific software, a high level idea, because different software have different workflows, features, but a high level idea is useful. Yes. And then problem solving and analytical skills gradually you develop as you progress through the career. So not to worry more about it, but it will be useful to do some projects related to solutioning. You can talk to people in your circle who are working for software companies or who have their own software companies. Try to, for freshers, I am saying this, try to get involved in requirement analysis. That will give you a good idea on how to respond in the interview for related questions. A lot of people may have done some projects in their uh, during their courses also. So this is in that direction. And then communication skills, of course, a lot of times the prospect, the client is from Western countries, so good English is important. It is required, and it gives you an edge over the other people in the interviews and in the selection process. So please work on your English part. If you can't make out any other way how to improve your English, what you can do is uh, you can start researching on any product and interact with the marketing and sales people of different companies. They will help you improve your communication skill. I think you can understand what I'm trying to indicate. And then some idea of the project management methodology is required. Not a very detailed idea, just a high level. If you will search on the internet, you will get a lot of material. Just a basic idea you need to understand, like in project management, you know, what is uh, different type of resources that are managed, how a project life cycle goes, things like that. Collaboration tools is important for like mid-career or early career people. For freshers, it is not required because it comes gradually with the experience. Different collaboration tools are used in different companies. So there are tools like Jira. So a lot of tools are there which help teams collaborate and work together. It is about those tools. Then data analytics, as we see, data analytics is now being used heavily in different industries. There are a lot of tools and a lot of features in these applications, and a lot of data analysis is being done for the objective of understanding the needs of the customer and how to focus on the relevant areas. So an example we can understand, like in the retail industry, if we see around festivals, there is specific need of certain type of items. Like for Eid, a retail chain can focus on keeping the items which are important for this festival, so people will be buying more. And for example, in around the weekend, a lot of people will go to buy groceries. So analytics will give an idea of to a particular retail store what items are in demand in which type of day of the week or the month of the year. Around March, lot of people who don't have good financial planning, they run out of money, and then the buying goes down. That is the fact. So this comes under analytics. And then use of automation, LLM and AI agents also will touch briefly, as this is something which is growing in all the industries. So likewise in healthcare also, automation is coming in a big way. So we have a lot of automation tools. There is a specific blog post also which I have put together for the leading automation tools, 5, 6 automation tools, and a brief overview of them, which I'll be periodically posting in the careers group. Then LLM is large learning model, which is related to chat GPT type of solutions. And then AI agents. AI agents are nothing, but it's easy to understand. If you nowadays, if you log into a website of a bank, you will get a chatbot on the screen, which will ask you some questions. And that is not a human, it's basically a chatbot. And it will ask you questions quite similar to the human customer service person. And when you start interacting with it, it will ask you further questions on the relevant topic that you have initiated. So that is AI agents. And now this is a very simple example I gave. It is almost, you can understand, like the simple tasks that a human being is doing, those are now being facilitated and being configured to be done by AI agents. So there are things like, for example, if someone in our audience has got a lab test done by pharmacy, then you know that if you do a lab test after a couple of months, it will remind you that in your previous lab test, this parameter was out of range. You will get a WhatsApp message. Would you like to get those tests done again? If you got like 20 tests done, it will an AI agent from pharmacy, a chatbot will reach out to you through WhatsApp and remind you that your two parameters were out of range. Would you like to get it done again? So this type of agents. These type of agents are coming in a large way in the market. So now the trend will go in the direction of, it's very important to understand. The trend will go in the direction how to configure the AI agents, rather than the humans will now not be acting for simple tasks. They will be gradually replaced by AI agents and chatbots, and the humans will be required to configure them and to see if these agents are interacting properly with the customer. So the role of the supervisor or the trainer, that will be taken up by the humans. The simple task will be done by the bots. So we have to skill ourselves accordingly. You imagine yourself as being a supervisor of 3, 4 initial level or basic level clerical executives which are working for your hospital or your lab or your healthcare uh, uh, data management company, and then you have to supervise them and train them. If you imagine like that, then you will be able to give very good answers in the interview. So now we'll briefly touch what is uh, an EMR and EHR. So lot of times this question will be asked at all levels of interviews. What is the difference between EMR and EHR? Just put it in the first point. that, EMR is a simpler solution, where, one care provider will capture data of the patient, and what EHRs are intended to be used by multiple care providers across different healthcare organizations. What it means is, like, if, for example, a blood test was uh, and X-ray, these two things were prescribed by a doctor in a hospital, and you got it done from uh, another healthcare organization. For example, this you got it done by a lab like Aarti Diagnostics. You were prescribed the lab tests by like Premier Hospital. So Aarti Diagnostics will enter the results in the same software solution, and then you visit a third hospital. For example, you visited this Olive Hospital, and you uh, consulted a doctor there. So that doctor also entered the data in the same medical record, and because that particular specialty was not available in Premier Hospital, so they referred it to Olive Hospital. So all these doctors are working and entering data. Just don't. Yeah, someone is asking a question. Please tell me. Is someone asking a question? Okay, no problem. We'll have a dedicated QA session in the last like 20 minutes. So, so that is EHR, where multiple care providers and healthcare organization enter data as needed, and they work on the same patient. So then there is something called as HIE, which allows healthcare professionals and patients to access the data from a single hub. And simple example you can understand, like 1mg.com is, if you get the lab test done there, they provide consultations through their doctors also, and then they give a facility to share your lab results with other doctors. That only the link they give, but some other companies they give uh, a feature where you can share the link with your doctors. There's a Hyderabad-based company, which has grown a lot in the last 5 years. They provide healthcare services to companies for the health and wellness of company employees mostly. I don't remember the name exactly, but they give a provision where the patient record can be accessed by any doctor for to which the patient shares the link. So then another thing is IHE. IHE is an initiative by healthcare professionals and industry. It's just to improve the way computer system in healthcare share information, just to streamline this one. And now I wanted to cover revenue cycle management, which is I think 50% of the volume that I can see in the industry, the business volume, it is coming from this area. Now, what is this area? We want to briefly understand. So, this is a simple diagram which makes you understand what it is basically, and then after that, the next slide will be a bit complex. So, this is in the simple diagram. What I wanted to explain is that if you see, this process starts from the scheduling. Scheduling is nothing but the scheduling of the time when the patient will interact uh, uh, with the doctor, and at the time when his consultation will start with the doctor. And then there will be when the patient will select the appointment time when it will be fixed. Patient has to go for a registration, and after that uh, his insurance details are verified. This is purely in context of US healthcare system. In the industry, around 85% of business is coming from US healthcare clients. So whenever you will apply for a job, 85 of the percent of the time or 90% of the time, you'll find they are related to the US healthcare industry. Only like 10 to 15% are related to other parts. That there are two reasons for it. One reason is that US is a very large economy, and uh, um, as compared to the other parts of the world, the question comes to the mind, why this much, this such a high percentage of the business coming from US. The other thing is, the other parts of the world, like Europe, they have good paying ability, but they don't have streamlined systems, and they don't have a standardized process of healthcare processes. Similarly, in the Gulf region, they have good paying ability, but they are totally, unfortunately, totally dependent on the US companies for their healthcare solution part. Cerner and things like these software are implemented over there. So what I want to say is that the entire Gulf region, the high paying clients are itself, they are being catered by the processes which are defined in the US, and the companies which are mainly uh, having solutions based on the US standards. So um, if you see here, this in this diagram, we have this. I was at the insurance verification stage. So here, a simple verification message goes to the insurance provider to verify if this particular patient has the insurance coverage that he's claiming to have. And then the second part is the coding and charge capture. This is the stage where medical coding thing comes to picture. What we keep on listening everywhere, medical coding, medical coding. So this is about this step. Now, if someone has a particular health problem, this stage will comprise of the care provider or the nurse, or the one who is taking, who is collecting the data to enter the problem of the patient in the particular medical code. So these codes will, we are coming to the coding systems in the next slides. But here the problem of the patient will be converted into a particular code, because that code will be further used for uh, the charge posting and for tracking the medical record of the patient with respect to the payment that has to come to the hospital from the insurance provider. So that is basically the objective of the revenue cycle management, is that if the patient has gone for consultation, whatever services were given to the patient, those are captured in a structured way, and those are correctly conveyed to the payer, that is insurance provider. Or sometimes the payer will be the employer of the patient. For example, he works for a company. If someone works for, like, Microsoft, maybe some Microsoft will be paying some part of his healthcare expenses. If someone is working for Caterpillar is a large company which makes construction industry related heavy machinery and lot of things it makes. So the employer sometimes pays a part of the healthcare expenses. So these healthcare expenses are, will be properly documented and sent to uh, the entity which is paying it. So we can understand that if a patient was provided certain number of services, for example, he was provided some procedure was done for him. For example, he got a dressing done, or he got a physiotherapy session. So it has to be properly documented. If the physiotherapy session or the consultation, as per the time taken for it, if there is a consultation of 10 minutes, it cannot be equal to a consultation which takes 45 minutes. Charges will be different, so code will be different for it. So for consultation and physiotherapy sessions, things like that, or even for a procedure like wound cleaning, wound dressing, for even for surgeries, there are codes called CPT codes, which will be defined in the next slides. Definition will be given and details. So these codes have to be properly put. If we put incorrect codes, that will result in lower payment to the hospital. So, and if we put a wrong code in a way that the expense are captured more than what is required. So that is also, that will make the insurance payer or the employer unhappy, right? So that is why this industry becomes very important, the medical coding industry and the activities revolving it, that accurate posting of the charges is needed. Hope you can understand. That is why lot of medical coders they get promotions and they get good pay if they are accurate in their documentation of the medical procedures and charges. Any question in this part, because this part is important?
Documentation, as in like what kind of documentation?
Your voice is slow. Please speak loud.
I'm saying documentation, as in like what kind of documentation? Which is elaborate.
Please type it in the chat box. Your voice is so low, I cannot hear, understand. You type in the chat box, I'll respond.
Can you hear me now?
Yes, yes, I can hear you now. Yeah.
Yeah. So what I'm saying is that, as you mentioned, the documentation. So could you please elaborate that? What kind of documentation is it?
So
Like the readings, correct readings or something?
but actually this is something where you know what happens is the if you have visited a hospital, the doctor enters your uh, medical data on the doctor, just writes down your problems on the prescription paper, right? So in the West, in the US, they enter these type of your medical condition related data in the computer system, and then after that, in the EMR or EHR, they enter. After that, there are medical coders which will read through that data, and some codes doctor will enter, and the other codes the medical coder will enter based on whatever is written in the medical record. So it is like that. For example, if you can understand it in a way, like for example, in India, if the prescription is there, and after the consultation, if some hospital has a system of payment, what they do is, if you see, whenever someone is discharged from a hospital, you get a very long and some 5-6 pages of details of what all services and what all items were used for the patient during his hospital stay of 2 or 3 days, right? So a detailed breakup of the services given to the patient is mentioned there, and whatever consumables, whatever items were used for it, right? So this step is basically regarding that. It captures in detail what services and what procedures were done for the patient, and what problems he has, and what procedures that is services were given to the patient. It's not difficult to understand, because healthcare industry is something which we all keep on going through these scenarios whenever we go to visit a hospital as a patient. It is easy to understand. We can discuss more in our careers group if you want for medical coding. I have a couple of blogs, but I can create a
Yes, understood. Thank you for that.
yeah, I can create more things, more posts. Then if you see the next stage, medical records are used in this cycle. Then after this proper capture of data is done, claim submission will be done. In after claim submission, the employer of the company, whoever is paying, they will verify if the claim has the correct data or not. And then patients will the payments review will happen. Some part patient will pay, some part payer will pay, some part his employer will pay. So this is how this cycle gets completed. And practically being in this industry for about 20 years, I can see around something like 1% of error happening. Because there's multiple steps involved. So 1%, 2% errors, keep happening in different stages. So the whole objective of this whole exercise is to accurately get this revenue cycle completed with minimal errors. So I'll just briefly touch on the other things also. So this is a detailed view of the same revenue cycle management cycle. These are the standard industry standard terms that are used because they have broken down into specific defined steps where specific set of activities are done. So if you see the arrow at the bottom, prior patient registration, that is the starting point. After that, the eligibility and benefits check is done. That is how much benefits and eligibility this has. For example, in US, government also gives benefit to people who are old, above 60 years of age. Whatever citizens are there, they get a special type of scheme called Medicaid, which helps them pay for their medical bills. And then not all, but like to great extent, like something like 70% Medicaid will pay for them. And all type of problems will also not be covered, but most of the problems will be covered because there's a large number of aged population in US. In the all the developed countries, a large amount of aged population is there. India also it is growing. That is why we can see services and products related to healthcare of aged populations growing in India and even the world over. So if you see here, these are the different steps. What I can define is clearinghouse denials. So if you see in the top, there is a step called clearinghouse denials. What is that actually over there? A review is being done of the charges posted against the services provided, basically verification of data. At this stage, lot of errors come into picture and they send it back to correct the data. And the data is corrected and sent back. Then after that, it is sent to the next step, that is payment posting. After payment posting, some claims will be denied. So that will go into denial management process, where two things will happen. Either the patient will say, no, this data is correct, and I think I should get this claimed payment, but that is a very small part. The large part is that the data is found incorrect actually by the insurance provider, and the patient is expected to correct the data and send it back. So then the payment gets done. And then we have, so that is basically the secondary filing. If you can see, there is a secondary filing that is basically apart from the first filing of the claim. And then account receivable, after the insurance company has agreed to pay, then this account receivable team is there, which follows up with them to get the payment within time, because hospital has provided the service, and hospital keeps on following up with the employer, with the different agencies, government, insurers, to pay the bills. And if still the patient thinks that his expected payment was not done, then there is a appeal process. So this is how this cycle is broken. Now there is something called as FHIR. Now I'm just coming to the standards actually. The FHIR are basically the it is a format actually in which different healthcare systems exchange information. So for example, the last example that I gave, someone went to Premier Hospital, and then Premier Hospital advised some tests, some special kind of test, for example, immunological study that was not available at Premier Hospital. X-ray and blood test was also advised to the patient. So X-ray blood test was done at Premier Hospital, but for immunological study, he was sent to advised to go to any external diagnostic lab. So how will the patient data be sent to him, sent to the lab? So only the patient's medical record with the data, it will be sent to that particular lab in FHI format, because that is a standard format in which different software solutions exchange data. So it is not important that RT diagnostic will have the same software solution installed. There may be different software solutions, but because of this particular standard data exchange standard available, this data will go to the other system via APIs, and the diagnostic lab can view the data of the patient because they have to do the particular investigation advice. So patient will not be expected to take any paper or anything. And after that, the results also can be sent back to the hospital. And if over there it was found that he has some specific problem for which the specialist is not available at Premier Hospital, they will refer the patient to a particular hospital. For example, they referred the patient to Olive Hospital. For example, they found some oncology problem. At that time also referral will be done in a format which will have the data of the patient sent to the Olive Hospital, different hospital. And that data will be also sent in FHIR format using FHIR. So if you see, for people who know the technical aspects, the second point, if you see, FHIR supports JSON and XML formats. Earlier use was done by HL7 mostly. HL7 used to support only XML. So if you see, JSONs are commonly used nowadays, so FHIR supports JSON. So if a lot of resources are available for FHIR on the internet, you can go through it. There's an official website. It's nothing that they have paid areas of the website or important things are available only as paid versions. It's not like that. It's quite a public and openly available website. So anyone can go there and start reading about FHIR resources. I can share that in our group also. Even here also I can share. Just a moment. But we lose this view. So I'll share the FHI resources on our careers group. So now this is a brief about ICD-10. ICD-10 standards. ICD-10 basically it was started in 1970, and in 1970 it was a small set of PAs. Now it has grown very large. It runs into lakhs of codes, and latest version is called ICD-10, which has come in 1999, and now ICD-11 is also getting uh, formulated. So how this ICD-10 works is, I'll try to show you. So if you see now, the medical coders also, they enter data in the form of ICD-10 codes and CPT codes. So we are now going to see some ICD codes. So if you see fever, so if you can see here, different type of fevers are there. Paratyphoid fever, unspecified fever, that if we don't know the cause of the fever, we'll specify the code R50.9. If we know that it is due to typhoid, we'll specify A01.000. If we know that this fever is because of dengue, we'll specify A90. So this is how ICD-10 codes work. Now I'll just give example of CPT code also. So we commonly hear of people undergoing cardiac bypass surgery, right? So for that surgery, CPT code is 33533. Now these codes are maintained by the AMA, American Medical Association, and so for each um, For each health problem, there will be specific codes. So that's why I just showed you two examples. And just a moment. Then there is something called a SNOMED city. It's not very much used, but I think you should know it. So I just mentioned it here. SNOMED code is used in some countries, apart from ICD-10 codes. Those don't have alphanumeric characters, only numeric characters are there. Then there are codes for mm, uh, other type of data, like for drugs, there are other set of codes called number of codes are there. Sorry, RX norm codes. Then there are NDC codes. Those are only for the drug related data, medicine related data. Then there are specific software used in healthcare, Epic, Cerner. These are some examples. There are many other software solutions. These are the popular, and well-known ones. So I just mentioned them. A lot of YouTube videos will be there on the internet for the software solutions. You can get a brief idea on what areas and what basic features they have. So it will not be much difficult to go through them. And the other knowledge and skills that are required for this particular career is that you should have an idea of like change management. Change management, why? Because if a new software solution, a new EMR or EHR is getting implemented in a software, for example, Epic is getting implemented, you should know what change management activities will be done to replace the old solution with the new solution. So it's a specific methodology of change management. The basic points you can read through. You can find plenty of material on the internet. And then there are some standards which talk about patient privacy. That is, healthcare data of a patient should not get exposed to the people who are not supposed to see them. For example, only the doctor who is treating the patient, he should be able to see. And this data should be in the format, secure and encrypted format, so that it is not being accessed by unauthorized people. So there is a standard known as HIPAA, HIPAA, and HIPAA standard talks about that. Then there is GDPR, which is used in the European region. It also talks about the rules, the regulations for the different solutions and processes. And then the you should also have a basic idea of the agile process, because like 15 years back, I think mostly the different model was used, but now agile model is being used in the industry. So you'll get a lot of questions related to agile process, which is related to the roles. If you keep on hearing and reading in the job descriptions, like Scrum Master, Product Owner, these are the roles which are related to the process called agile process. If you ask in my career group, I can also share some material and you'll get a basic idea of what agile process is about. So now I think we can have a QA session. We only have like 15 minutes left. Please go ahead with the questions if you have.
Khalid, if you want, you can continue and take some more time. That's okay. It's up to you if you want to continue.
I can continue. I have a lot of material to tell and show.
Or
But
maybe we can arrange some other session after a few weeks, inshallah.
I can see some questions coming when people come in.
Yeah. We can take questions now.
Okay.
So audience can unmute themselves. You can just unmute and ask a question directly.
Hi, Assalamu alaikum. This is Akbar here. It was a nice introductory session. I am like I have basically two questions. First one is like if so I am from like QA background. I am
Okay.
leading automation. I have bit of a like healthcare experience, but like if I want to like as the meeting stated, if I want to get into this business analyst or product manager,
Uh,
what should be my roadmap? That would be first question. And even if I get into the such roles, what kind of initial expectation in that roles? If you could like elaborate on that, that would be helpful.
okay. So I'm just giving my phone number and email again. However, it was given last time also in the initial flyer, right? So this is the phone number and email. I have WhatsApp everything. So I can see some questions coming in the chat box. I'll cover it after your question. So see, product manager actually, as I told, product manager has a larger role. That is, he is given the responsibility to analyze the market, to understand what the market wants, to analyze the gaps, to analyze the weak points of the other solutions, and then to come up with the roadmap for the solution which the company is planning to roll out in the market so that it gets good market share. For example, at any stage, we see like if we assume like I'll tell you one good example like e-commerce platforms, right? If we see like 5 years ago in the presence of Amazon and Flipkart, we had Snapdeal also, we had some other shop clues and things like that. But people used to assume like 95% people will think there is scope for no other platform now. Because Amazon, everything we can find in Amazon and Flipkart and Snapdeal, how can any other platform grow in this kind of environment, right? But then in the last 5 years, we have seen so many startups coming, so many companies growing in the e-commerce space, like Meesho. Now, what was the model of Meesho, or how was it different from them? Because Meesho had a slightly economical pricing as compared to products available on Flipkart and Amazon. So that was the gap in the market that Meesho identified, and the basic point that Meesho took was it empowered the small and medium shopkeepers to reach out to a larger customer base through e-commerce. These two things helped Meesho grow. And it did not face much hindrance. It has grown to a large organization. It has very good balance sheet. It is a very healthy organization. In contrast to companies like Baiju, which have just collapsed. So like that, you have to identify the gaps in the market and you have to make solutions according to that. That is the role of product manager. That is why in the introductory message also, you did not see product manager, you saw assistant product manager, because after business analyst, directly responsibility of product manager is not given. Rather than some responsibilities will be given, which come into the zone of assistant project manager or associate project manager. After that, product manager, if someone is made, he will be given the complete responsibility. Analyze the market, find out the gaps, draw a roadmap, make a plan, and you have to be accountable. Like in the in 1 year, how much business was, how many leads were received for this particular solution, how many customers were made, how much earning company is doing. These type of questions product manager will get. All right, so what I suggest is start going through some courses. There is a good course by available on Udemy, and even I got an opportunity to contribute to that course. So it's a course by internationally famous personality for product manager. I'll share it in my careers group. Let me just note it down, whatever I have to share in my careers group. So one thing I have to share is about product management. Other thing I have to share is some details about medical coding. And then I'll also share some details about medical AI agents, that is bots. So these things I'll be sharing in my group. Course details will come in the jobs and careers group. I'll just share the link. Wait. I'll try to share the link here. Just wait a moment, please. Actually, the link is there in the this one in the message about this session. The link is there. Telegram group link is there. If you don't find it, no problem. You can message me on WhatsApp. I'll be sharing over there. No problem. I'll share the link of the group as well as this one. So I'll just take other questions maybe. So hope I answered your question, brother.
No, actually, I was looking for a roadmap. Since you suggested course, if you could share them.
So roadmap is simple. You have to do some courses on product management, and you need to get in touch with some product managers whom you know to understand what work they are doing, and then try to identify gaps and fill those gaps. It's very simple. So, and whatever role you are able to get, senior BA, associate product manager, simple business, because business analyst role is also very different in different companies. In some companies, business analyst role is a very large and quite diverse role, and quite good paying also. Product managers are very few only, and mostly I've seen most of the important work being done by business analysts in a company, the kind of work that we discussed in the session just now. Product managers have a quite a overlapping role, which they have to work with almost all the verticals like sales, marketing, then even finance, because as I told, they are accountable for how the product is doing in the market. They are directly asked questions. Okay, so it's not something to jump into easily. Gradually you will move into that role, but what I can add is it's a role of high and diverse responsibility, which gradually you will start gaining confidence in those particular responsibilities. As you move from associate product manager to product manager, you'll gain. And above product managers, we only have VPs, vice presidents of the company. So you can understand what the level of responsibility that these people will have. So then,
Hello.
yes, just a moment. I'll just take some questions in the chat, and then after that, I can take more questions. So one question is, medical coding can be done by non-medical professionals. So it's all about terminologies, as I explained, the process, the revenue cycle process, and the procedure codes, CPT codes, and the ICD codes. So you can understand that it will be a bit easier for any healthcare professional. He may be a physiotherapist, he may be a VOMS, he can be a BHMS doctor, MBBS. So frankly, what I can say is medical coding only is not a high paying job. High paying job is business analyst, associate product manager, roles like this. But why I mentioned medical coding is because I've seen people moving from medical coding into these jobs. And people keep on coming to me to take guidance on job roles, career roles, and to refer their resumes to different companies. I keep on telling people to understand and get into the revenue cycle process management process, and move ahead from medical coding, because medical coding, whatever level you rise, it's very it's even rising to team lead or manager level, then you will start getting some good salary, and after that also the ladder from above that level to more senior levels is a narrow one. So the better thing is to get into RCM process, understand RCM, and get into the different roles which are related to the RCM process. Don't think only about getting into medical coding. So the takeaway point is to target the role of a business analyst, not of a medical coder. And so hope that answers the question. So medical coding can be learned by anyone. Anyone can go and learn medical coding, take some certificate, and enter this field. Similarly, business analyst also, business analyst healthcare, easily it is easy for people who are from who have done some MBA in hospital management, or sorry, not but who have done some physiotherapy course or some BMS course or some BHMS course or some BDS course, but it's not that They will not, people who from non-medical background will not be able to understand. It is not difficult. People from non-medical background can also understand by spending some time. They can understand medical terminologies because as I said earlier, this industry is directly related to our day-to-day life. Also, we keep on consulting doctors by, when we visit hospitals as patients. So we understand the basic process, right? It is not something like a aeronautic engineering or logistics industry where we don't understand things on the ground because we are ourselves part of the most of the scenarios. So it will not be much difficult to understand, and there are plenty of material now in today's world. Data and knowledge and theoretical knowledge is available very easily. This is the era of Chat GPT and the Google. And the thing is that you need to organize, you need to focus on which areas are relevant to you. Not your data and knowledge are very easily available nowadays. And next question that I can see is about the HIPAA guidelines. I already answered. And how can we improve communication skills in medical industries? Good question. What I can say is make yourself familiar of the terminologies that are used, improve your English, and then give more and more interviews. These are three methods which will help you improve your communication skills. The career group, I'll provide the Telegram link was given in the intro, in the message related to this session. Telegram link was given in it. However, if you drop a WhatsApp message to me, I'll share it again. And then we can see someone asking complete complete graduation Pharma D in 2023, complete training for IPDRG months after completing training. Now every company is experienced IPDRG. So there are a couple of certification for medical coding. You can take any of these certifications and get into it. They are quite few of them, not very much. So medical coding certifications are available. What I can say is just a minute. So the leading certificates among those, let me just check. Even in Hyderabad, we have this people giving training and helping in certification. So there is someone known as Dr. Madhu, who is he's a male, and he gives certificates, is a training and certification guidance. And I think somewhere, I don't remember the exact name.
Hello.
Wait, I'll tell you. You can ask me over WhatsApp. I'll try to help you with what is the medical certificate. Exact name of the certificate I'm missing because CPC. So actually, the higher level certification in this area is CPC, that is Certified Professional Coder. And below that also there is one certificate available. CPC medical coding CPC Certified Professional is the actually, if you talk about this medical coding certificates, they are not very difficult to get through. So the standard one is CPC, and apart from that, others are also there. I'll try to elaborate in my career group. If we can discuss that, I think I'll try to find something later. At the moment, whatever I can see is CPC is something you can target. So that is about it. Fine. Next question is about salary range. Salary range is very wide. It increases rapidly. For entry level, you will not get much salary, but after 1 or 2 years of experience, your salary will rise quite rapidly. That is present in all the industries. The same rule applies. Nowadays, for business analyst, a lot of new solutions are coming in the market. So you can get good salary as a business analyst, but you have to get a basic idea of all the areas that I have talked about. That will help you crack the interview. Now, data scientist in healthcare domain, what skills are required? For data scientist in any domain, first you need to have a good understanding of the processes and the functional part of that domain. So that is why directly going and doing data scientist role without having domain knowledge, will create some difficulties in working in that domain. So if you have some functional expert helping you, then definitely data scientist can do anything. But it is good to have some knowledge of the industry. So what I recommend is first work for some time as a business analyst. After that, try to get into the data science part or a data scientist role. HIPAA compliance, I think I have explained.
Sir,
Okay. For Asif Saw, I'll check your message on WhatsApp. Yeah, tell me.
I'm a Dr. Wajid.
Yeah, tell me.
Actually, with the help of some technical team, we developed a telemedicine platform just like Practo.
You can talk this offline. This is not the forum for that.
Okay.
Yeah, any other questions for people looking for career change or this one?
Just on the salary range,
Yes, tell me.
the good salary, I mean, it's a bit relative. So if you know, if you could give the numbers, like what range we can expect.
No. Who will give you the numbers? How will someone give you the numbers?
The range. I'm not asking the exact number.
Yeah.
The range, if entry level.
It's quite decent as compared to other roles. It's quite decent as compared to other roles because everyone knows that at the moment, every single industry is in pressure. Nothing is left. So healthcare solution industry is comparatively into low pressure. That I can say. It's a bit easier to get a job in the healthcare solutions as compared to other industries because this industry doesn't get a recession. Only the uh, the compensation part will get a bit reduced, but jobs will be there in this industry because hospitals cannot close. Healthcare keeps on going. So what I can say is it's easy to understand if you put yourself in the seat of a medical solutions company owner. If you have a medical solutions company owner, if you start staffing, I am sure you will have some people who have their own software companies. Just sit with them, try to understand how do they hire people. They pay very well to people whom they think will be helping them in critical processes and who have knowledge to guide others. The same applies here. If you have adequate knowledge where you can guide your peers, your other team members, you will get very good salary. If you have basic level knowledge, entry level skills, you will not get good salary in any field. It applies the same. And if someone keeps on giving interviews and keeps on learning, he certainly gets a good position that I've seen in the last two decades of my experience. So I understand what you were trying to ask. I am sure I was able to answer it. If any other doubts are there, I'll be definitely willing to clarify. There are a lot of work going on in the healthcare industry, a lot of new solutions being built. As Dr. Wajid just now said, a lot of telemedicine solutions being built. But every solution and everything has to have certain characteristics. I myself being a senior product manager with some companies, I can elaborate on that part. You have to be very user friendly. That is number one, because there are n number of solutions in the market, n number of hospitals in the market. You take we should take our own example. Why do we purchase from Amazon, or why do we get a lab test done from 1mg rather than other sources? Why do I go to a certain vendor? rather than others. There are a couple of things involved. Number one is trust on the quality. Number two is professionalism. Number three is user friendliness. And then there is the pricing range that they have. So a lot of things come into picture. So I can add with reference to the last, earlier points that we covered, the product manager is also responsible to decide the pricing of the software solution. If we have a large client which is taking a small part, a part of our solution and taking a couple of features, we give it on a very reasonable price to that particular customer, because our target is gradually to gain his confidence, and later he will take other solutions from our product also, from our product range also. So pricing part also becomes a responsibility of the product manager. This is with reference to the question asked by our QA brother. So product manager role is a very diverse and a large role with lot of expectations. So that is why I'm again telling for the audience of this particular session to target to get into the role of a business analyst. Anyone who has asked any question in this session, I suggest try to get into the role of business analyst. Avoid the medical coder role. How should the resume be so that a company calls? Very good question. I have posted a lot of material with this regards in my career groups, and I'll specifically I can share those links to you also. What you can do is drop me a WhatsApp message. I'll drop my career guidance group link, and I'll share this particular 2-3 posts I have which help you make a good resume. Even a lot of websites are there which help you make a resume, which nowadays is required because nowadays humans don't screen through resumes. Resumes are being automatically screened by bots, and bot friendly resume, how to make it, I have put together some posts and I'll share it in my career group. I note it down. Just drop me a WhatsApp message and I'll share the career groups link to you all. So you may anything else, please. Anything else? I am available
From the
for-
audience,
Yeah, tell me.
I'm just asking from the audience, do you have any other question before we close this session?
Sir, how to contact you after this section?
I have given my email, phone number, everything. You can also
So are you?
welcome.
I mean, okay.
I stay in
Just regard.
Hyderabad. We can meet. I am available for a meeting every month.
Okay.
Yes.
Regarding the HIPAA
Will be
complaints
open
only,
for-
I have queries, sir. I am the chairman of a hospital, corporate hospital. At the same time, I'm developing the Practo-like platform, online telemedicine consultations.
You can
So
contact me on my phone number. We can continue the
whatever whatever the sessions details you have discussed right now,
Yeah.
we require all these people. So that's I need a HIPAA complaints regarding that only, how to add on it to the software. That's regarding about that. If you have time, if you give some specific time,
I
we'll
provide
contact you.
consulting for a fees, and we can discuss that one after the session.
Okay.
Automation. Very good question. Okay, automation related post also I'll share on my career group. First you join the career group, I'll share these things tomorrow maybe, so that whatever people are planning to join, they'll join the group, and I noted it down and I'll share the post related to automation topics in that group itself. In healthcare. Rather, I'll try to put together a post for automation in health with context to healthcare. But I already have some blog posts which highlight the 80% of the leading automation solutions. You may have heard of a lot of them. One is Automation Anywhere, and one is UiPath. And then a lot of companies are also coming up with their own automation solutions. For example, ServiceNow has given a lot of automation solutions recently. So I'll share this material. It will help you because This may be a question in the interviews nowadays. Yeah. Person from non-CS and non-medical background can get into business analysis. Non-computer science, non-medical type background. Business analysis is actually business. What is business analysis? Business analysis is about the skill to be able to analyze the business process of a particular entity and then to give solutions in that direction. So having said that, it doesn't require any specific degree or any specific background. You can develop that skill gradually moving on, because I've seen people from non-CS background and non-medical background, lot of people from non-CS and non-medical background making very good careers as a business analyst and as a product manager in the healthcare solutions domain. Fine. So I think we can wind up the session now. I'll again give my phone number for someone to reach by WhatsApp, so that I'll give the link to my careers group, and further queries I'll be answering in that one.
Okay, thanks a lot to everyone, and a special thanks to Dr. Khalid Sab. Jazakumullah khair. It was a really very useful session, and inshallah we'll keep on having further sessions on this topic also. So with this, we close this session. Thanks everyone for joining. Assalamu alaikum.
Assalamu alaikum. Thank you. Most welcome.